Why is pyelonephritis a serious UTI in children? Imagine a tiny child with a high fever, chills, tummy pain, and maybe even throwing up. These signs might seem like a common stomach bug, but they could also mean something more serious happening inside the body. When a urinary tract infection reaches the kidneys, it is called pyelonephritis, and it is a serious condition in children. This is because the kidneys are vital organs that help filter waste from the blood and keep the body balanced with fluids and minerals. If the infection spreads to the kidneys, it can cause more severe health problems than a simple bladder infection. One reason pyelonephritis is so dangerous is that it can make children very sick very quickly. They might develop a high fever, experience chills, and have pain in their sides or back. Sometimes they may refuse to eat or become very tired. If the infection is not treated promptly, it can lead to dehydration, which might require giving fluids through a vein in the hospital. In more serious cases, the infection can cause abscesses, which are pockets of pus in the kidney, or even lead to kidney damage. If the infection spreads into the bloodstream, it can cause sepsis, a life-threatening condition that needs urgent medical care. Another reason why pyelonephritis is so concerning is the risk of long-term damage to the kidneys. When the infection causes inflammation, it can leave scars on the kidney tissue. Over time, these scars can reduce how well the kidneys work. This can lead to chronic kidney disease, which might cause high blood pressure or, in very severe cases, kidney failure. Studies show that children who have kidney scarring from repeated infections are at higher risk of health problems later in life, including high blood pressure and the need for dialysis or a kidney transplant. Children with certain urinary tract problems are more likely to develop pyelonephritis. For example, some kids have a condition called vesicoureteral reflux, where urine flows backward from the bladder into the kidneys. This makes infections more likely and more severe. Detecting and managing these underlying issues is very important to prevent future infections and protect the kidneys from damage. Diagnosing pyelonephritis in young children can be tricky because their symptoms are often not very specific. A baby might just have a fever and be irritable or not want to eat. Because of this, doctors need to carefully evaluate symptoms and often perform tests like urine analysis and imaging studies. Early diagnosis is key to preventing serious complications. Treating pyelonephritis quickly and properly is essential. Usually, antibiotics are given to kill the bacteria causing the infection. In severe cases, children might need to stay in the hospital and receive antibiotics through Enrollment 4. They might also need fluids if they are dehydrated. Follow-up care is important to make sure the infection is gone and to check that the kidneys are healthy. Sometimes, additional tests are needed to see if there are any lasting effects. In conclusion, pyelonephritis is a serious urinary tract infection in children because it involves the kidneys, can cause severe illness, and may lead to long-term health problems. Recognizing the signs early, getting prompt treatment, and monitoring kidney health are crucial steps to help children recover fully and stay healthy in the future. If your child shows symptoms of a urinary tract infection, it is always best to consult a healthcare professional for proper diagnosis and care.